This video clip will discuss the correct and most safe way to prescribe rotational self-mobilization to the upper cervical region. That's the C0, C1, and the C1, C2 levels. There's a couple things that we need to briefly review. When we talk about safely rotating the upper cervical region, we want to make sure that we don't place excessive torsional load on the V3 segment of the vertebral artery. That's the portion of the artery that exits the transverse foramen of C2 and then enters the transverse foramen of C1. And the other main structure that we don't want to place excessive torsional load on is the alar ligament, which is one of our special upper cervical ligaments. We can do that by coupling the rotation, which means that as we rotate, we're also going to simultaneously side bend. What that does for us and our patients is that minimizes the total amount of rotation that's occurring in the upper cervical region and thereby reduces torsional loading on those two important structures. One other quick thing to remember. If you have a patient who perhaps is a bit older and there's cervical spondylosis, higher levels of degeneration, and in the patient's lower cervical region, they've reached the stabilization phase. This is a patient who's just not able to rotate very well at all. You may also want to prescribe the exercise you're about to see because we want to make sure on that patient who has a very stiff older neck that they're getting the maximum amount of rotation out of their upper cervical region as well. Okay? So that's another thought process regarding prescription of this particular exercise. So let's take a look at it. Have the patient sit in a good posture with their chest up and bring their leather belt or their stretch out strap right underneath the base of their skull. Then we teach the patient to slide it down a ½ inch, and it would be over the posterior arch of C1 now, another ½ inch over the bilateral lamina and spinous process of C2. We then teach our patients to pull forward so that they compress their skin, sub-Q, and muscles against that spinous process and bilateral lamina. At this point, we teach the patient to side bend to the left and simultaneously rotate to the right. Again, this will minimize torsional load on the vertebral artery, minimize torsional loading on the alar ligament, and at the same time, give a nice stretching procedure to the facet joint capsules, both on the left and the right side, at the C0, C1, and the C1, C2 levels. If left rotation is limited, we teach coupled left rotation, where the patient simultaneously right side bends and left rotates.